oxygen delivery OSCE video. And to identify the cylinder, it generally comes in a black and white cylinder. This one is white, so I'm just going to place that on the ground. Okay. First I need to check the regulator to make sure everything's okay. So I'm going to check the Bodex seal, which is on the inside, to make sure there's no damage or anything, or it's not breaking away. Then I'm going to put the regulator onto the oxygen tank with aligning the 3 prongs on the oxygen tank and on the regulator, and tightening with the dial on the side, ensuring it is tight and back a quarter turn. To see how much oxygen is in the tank, we turn this dial at the top. This one is not full at the moment, it is empty, but it has got a little bit in there, and so to see if the oxygen is working, we turn the dial on the side. Yep, there's oxygen coming out, so I'm just going to turn that off again and turn off the dial at the top. To bleed out the regulator, you turn the dial on the side until you don't hear any more flow coming out. Okay, so now I'm going to do the delivery of oxygen, and I'm going to use an acute mask, which you need a flow rate of 6 to 8 litres per minute, and it's around 60% oxygen, around about there. Okay, so what I'm going to do now is going to put the tubing onto the oxygen tank. I'm going to turn that on by turning the dial at the top, and it's on. Then I'm going to put it on to, I'll put it on 6. Now what I'm going to do is going to attach the mask to our patient, but of course, having his permission. So I'm going to and to tighten, I'm going to pull these two straps and squeeze the top. Demonstrating how to use a bag valve mask. First of all, we need to check the bag to make sure that there are no leaks. Yep. Now I'm going to check the reservoir bag to see if there are any leakages. So I'm going to pump it up. Yeah, this one seems good. So now I'm going to apply it to the other end. Attaching the mask and attaching to the oxygen tank. I'm going to be using oxygen at 10 to 15 litres, but today I'm going to be using it at 10 litres per minute. Now I need to use an OPA, so measure it up, insert it. So before I put the mask on, I need to use a chin tilt maneuver and put my mask on using a CE grip and inflating once every 5 to 8 seconds, looking for chest rise and chest fall. I'm also looking for gastric inflation, and if this occurs, get my offsider to apply cricoid pressure to the neck. Okay, so this is my basic airway adjuncts OSCE, and today I'm going to be demonstrating how to use an OPA and an NPA. OPA is used through the mouth, and indications for use are patients who require airway support. You cannot use if the patients are conscious, semi-conscious, have gag reflex, because that can cause vomiting. Measurements are from the mouth to the mandible. For insertion, what I'm going to do is going to adjust the head back, insert backwards, and twist 180 degrees around the natural curve of the tongue. The benefits for an OPA are they prevent obstruction from the teeth and the lips. It acts as a bite block. It also can be suctioned through and does not prevent isolated trachea or prevent aspiration. Use NPA with the nasal pharyngeal airway. Indications for its use are gag reflex, trismus, and oral cavity damage, and therefore cannot use an OPA. Caution, because on insertion it may cause bleeding and may be a kink because of the soft rubber. It also may pass into the cranial vault if there is a skull fracture. Sizing. I'm going to size the NPA from the nostril to the earlobe. Yep, this one fits. So for insertion, I'm going to lube it up. So I'm going to put lots of lube on it. Make sure it's all lubed all around. And for insertion, I'm going to insert into the bigger nostril. And if I come across any resistance, turn 80 degrees and slide it in. Be mindful not to force it in, as it could break. We're going to be using an LSU for suction, and first of all we need to put the patient in a lateral recovery position. To test the suction, we turn the suction on and include the pipe, making sure that it goes over 350 millimeters mercury. Also, we need to put our finger on the little hole here and test if the suction is going through. This one is working. Okay. So as we put the suction into the patient's mouth, we only go as far as we can see the oropharynx, and only suction on the way out in a circular motion. We do not suction for more than 10 seconds, and we do not suction in a moving vehicle. From using suction, it can induce vomiting, brachycardia, aspiration, hypoxia, and the rigid catheter can cause soft tissue damage. Okay, so this is my vital signs OSCE, and what I'm going to be doing today, going to be demonstrating a heart rate, blood pressure, and a respiratory assessment. Grace, is it okay if I do this? Okay. So what I'm going to do first, I'm going to acquire her radial pulse, and I'm going to times it. I'm going to count for 15 seconds. 15 seconds, I counted 20 beats, which times by 4 is 80, so that falls between the 50 to 100 beats per minute range, which is normal. And I also noted that it was regular and it was strong. Okay, so for my second vital sign, I will be taking a blood pressure. Grace, is that okay? Yeah. So the BP cuff may feel a little bit uncomfortable as I'm pumping up. Need to ensure that the BP cuff is tight around the arm, otherwise you will acquire a false reading. Now I'm going to grab my stethoscope and find the brachial pulse. Okay, so the first sound that I heard was Grace's systolic pressure, which was 90, and her diastolic pressure, which was the last sound that I heard, was 64. So this is abnormal, as the normal rating is 110 to 130 systolic and 90 to 70 diastolic. Grace, is this normal for you?
Yes, it is.
Okay. Okay, so my last vital sign is going to be a respiratory assessment. So when you're doing this, you're not supposed to tell the patient what you're doing, as it might increase their breathing or decrease their breathing rate. So, Grace, is it okay if I take your heart rate again?
Yes, sure.
Right, awesome. But this time, am I able to put it across your chest? Okay. So I'm going to count for 10 seconds. Okay. So in that 10 seconds, Grace breathed 3 times. So I'm going to times that by 6, which is 18. And that lies between the 12 and 20 breaths per minute, so it's normal. Okay, so this is my hemorrhage control OSCE. So what you need to do first is when you see a wound, you need to clean it with saline. Yep. And then apply a small bandage, as small as you can go, over the wound, and apply pressure. May you please apply pressure to that? Okay, now I'm going to use a crepe bandage to cover the wound. I'm going to do this tightly, and also I'm going to twist the bandage to get a more pressurified effect. And then now what you can do is you can tape it off. Okay, so for more catastrophic hemorrhage, you need to apply a tourniquet. So what I'm going to do is I'm going to put the tourniquet 10 centimeters proximal to the wound and tightening the windlass and putting that strap over top of it to make sure it doesn't come out. What I need to do now is date the time on the tourniquet And you know that the tourniquet is on properly if you can't feel a distal pulse or the bleeding has stopped. If bleeding is still occurring, you need to add a second tourniquet. So this is my fracture management OSCE video, and today Hannah has a suspected fibular fracture on the left leg. So Hannah, what I need to do now is I need to assess your leg. Is that okay?
Yep.
Am I able to pull up your hand?
That's right.
Alright, I'm just going to pull up the other side as well. Okay, so now I'm going to describe the plustis acronym. Alright, so Hannah, are you in any pain at the moment?
Yeah, about an 8.
About an 8 out of 0 to 10? Okay. Any loss of functions? Can you move your toes?
Yeah.
Yeah, okay. There doesn't seem to be any unnatural movement. There is a little bit of swelling in there. Doesn't seem to be any deformities in there, but yeah. Irregularity. Well, it seems to be a bit swollen, so that's a bit irregular. Doesn't seem to be any shortening in there. Cryptus, I don't hear any bones grinding together, and she doesn't seem in shock. So, all right, now I'm going to assess your cardiovascular and neurological integrity. So, can you feel this? Yeah, you can. All right, now I'm just going to check your cat refill. Okay, so Hannah, I'm just going to ask you a few questions about your family history. Do you have any known renal impairment? Does your family have any history of malignant hyperthermia? Have you had methoxyfluoride in the last week? No? Okay, cool. And you are obeying commands, so I'm able to give you medication. Alright, so your pain score is 8, you said, out of 0 to 10? Alright, now I'm going to get my offsider Megan to check my methoxyfluoride. But first of all, are you allergic to any medication? No? Okay. Alright, so...
Okay, so it's methoxyfluorine, 3 milligrams, expires in 2020.
Awesome, thank you. Alright, so what you're going to do now is you're going to just breathe this in. It is self-administered, so it's for medium to high pain, so you're able to take that and breathe in. Okay, so now we're going to splint Hannah's leg. So the splint that I'm going to use today is a cardboard splint. I've rested a towel in there so it's nice and comfortable for her. So Hannah, what I'm going to do now is going to apply this cardboard splint to your leg. We do have to lift up your leg, so it may hurt a little bit, but that is what the medication is for, so just suck that in when needed. Alright, Megan, may you please help me? Alright, can you just grab above and below the fracture site while I slide this in? Okay, so what I'm going to do now is I'm going to tie this bandage around up the top of the fracture, making sure that it is not too tight but tight enough so that it doesn't come undone, and below the fracture site doing the exact same thing as I did on the top. Alright, Hannah, so what I'm going to do now is going to do another cardiovascular and neurological examination on your foot. Can you feel this?
Yep.
Alright. Everything seems to be okay. Okay, so this is my C collar spine OSCE video. So the first thing I'm going to do before I put a C collar on is the nexus rule. I'm going to assess the nexus rule, and so the N stands for neurodeficiency, so you don't seem to have any neurodeficiencies. Evidence or suspicion of intoxication. She seems okay, doesn't smell like alcohol or anything. Extreme distraction injury, doesn't seem like anything else is wrong. Unable to give history of what has happened. Hannah, can you tell me what's happened today?
Yep, just was in a crash.
You're in a car crash? Okay. And spinal tenderness. Okay, so what I'm going to do now is I'm going to get Megan to secure the head carefully, just so that it doesn't move. And now I'm going to measure Hannah's head from the neck to the shoulder blade, and that's about 4, so I'm going to measure that on both sides and a tenth of it. Now I'm going to just squeeze it just to give it a bit more flexion. Excuse me, Megan, sorry. Yep, that's it. I'm going to use the nexus rule along with the Canadian C-spine guidelines and my own clinical judgment. I'm going to be using the LifePack 15. So to check the batteries, you turn it around, pull up the back here and press the buttons to see how much charge is in them. To take out the battery to replace, you pull this button here and take out. Just put back in like that. Turn back around. Okay, to press on, we press the on button up the top. First thing we're going to do is press Energy Select to change to manual mode and turn the dial and click the button. I'm going to turn it down to 50 joules just for purpose of this video. What I'm going to do now is going to press the options button and turn the dial down to user test just so that it can test the button. This may take a while, so I'm going to show you what is in the compartments. Okay, first thing that we have is a non-invasive BP cuff, and to use this there is a NIPB BP button there. We also have an EST CO2 button which goes in here and you turn to turn on. But I'm not going to use that today as it makes a hell of a noise. In this pouch we also have a SpO2 probe and the 3 lead which are on my patient so we can look at the screen. So in this pouch we have the defib attachment, the 12 leads, the in-date defib tabs, the GTM, aspirin, and a razor. It's now complete, so I'm just going to rip that off. User test has passed. Okay, so now I'm going to charge up the charge to deliver a shock. And to deliver a shock, I'm going to press the shock button here. And it has delivered a shock. To disarm a shock, I'm going to press the charge button again. But this time I'm going to press the dial down the bottom. Okay. To change the leads, I'm going to press the lead button just here and turn the dial down to my desired lead. So what I'm going to do today, I'm going to do the 213 leads. There's also the 23 AVF leads, but there are more than that as well, but we won't go through those. To change the size on the screen, I press the size and twist to my desired effect, desired size. To check the sounds, turn the dial again and press the button. Press the button again in the QRS volume and turn the dial to turn up. Turn back down, press it again and press the home screen button. To change to AED mode, we press the analyze button.
Analyzing now. Stand clear.
To go back, we'll just press the energy select button and turn down to 50 joules again. I'm going to change the lead size back to what it was, which was the 213. And to print out what is on the screen, we press the print button. And to stop, we press the print button again. Just going to rip that off. Okay, and in the back pouch here, we have extra paper if needed for the printer. And to open the printer, we pull this down here, open it up, take out the printer paper and replace with a new one. Put that back in. And close. To turn off the LifePack 15, we just press and hold the on button. If any dangers? Hello sir, can you hear me? Sir? No response to pain, no response to voice. Checking airways. Checking breathing for 10 seconds. He's not breathing. Hannah, can you please start CPR? AET1 calling comms.
Go ahead, AET1.
We have a confirmed R49 requesting R50 backup.
Copy that. Backup is 15 minutes away.
Analyzing heart rhythm. Do not touch the patient.
Stand clear.
Shock advised. Charging.
Stand clear.
Stay clear of patient. Deliver shock now. Shock delivered.
Start CPR.
Paused. Start CPR.
has anyone seen what's happened here today?
No.
No? Okay. Alright, Hannah, can you count to 30 for me, please? 7, 8.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Move the chest rise.
Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1. Ten, 9, 8, 7, 6, 5, 4, 3, 2.
Stop CPR. Analyzing heart rhythm. Stay clear of patient.
Stand clear.
Analyzing heart rhythm. No shock advised. Paused. If needed, start CPR.
25, 26, 27, 28, 29, 30. Twenty-five, 26, 27, 28, 29. So now we're going to use an NPA, which is naropharyngeal airway. Shut up, Megan! Yeah. For this OSCE video, I'm going to be using the LifePak 15 monitor to check the batteries. Indications of
It's okay, it's a blue book.
indications of oxygen use from mask. Saturate pineapples to the oxygen tank. We're going to turn it on. Yep. And the ideal rate is 6 to 8 litres per minute. And it is, oh, fuck's sakes. He's recording. Okay. Kill me now!